Good morning, ladies and gentlemen, and dear members and guests. First of all, I would like to express my sincere thanks to the organizing committee for having me here in this wonderful, prestigious meeting. I was asked to respond to these two questions before I came here. The first one was, what initiatives have been effective in addressing the most pressing issue in your health systems? And how has this shaped the workforce strategy in your community? I'm a clinician and educator, so I must confess that I thought a little bit big for me. So I had a very quick consultation to my high-ranking officer in the Ministry of Health, happened to be my friend, and also asked the same question to my public health faculty members. But surprisingly, among many, many issues, there seems to be some kind of a consensus. So I would like to focusing on two things. But before that, I briefly introduce about our country. Korea is a small country, territory-wise very small, but is we have 50 million population. When small, our GDP ranked world 11th by IMF report in year 2016. The life expectancy for male is nearly 8 years, and for female, 86. And health expenditure, year 2014 report showed is 7.4% GDP. But that's based on the government statistics, but there is invisible amount of money used for health as well. So we think around 10% they use for the health expenditure. Our characteristics of the practice is very much specialist-oriented care, and we have a very weak generalism. Since the inception period, we learned from the Japanese model that is very, very heavily specialty and technology-oriented medicine. And recently, the government kind of has economic development is staggering, so they like to find a way to use medicine to generate more income for the country. And the one significant problem we have also is if patients want, they can visit anybody they want to go. There is not really the gatekeeping mechanism in our healthcare system. So the two things I mentioned there is one, public domain. Government officer, whoever I spoke to, they all say that their achievement was National Healthcare Insurance Plan, which implemented quite early in the 70s. And from non-government sector, we have an issue on privatization of health workforce. In other words, the education was done by private sector, mainly by private sector. Even the hospital service was provided by non-government sector. And this diagram shows that we start our national health insurance system quite early in 1977, even before our national income per capita is below $1,000. Because our economy began to move at the time, and there was a sudden upsurge of healthcare need. Government was concerned about this and became a kind of a social outcry, particularly for the poor people. So General Park, at that time, was a strong leader against opposition to professional society. He imposed it in one day, suddenly in 1977. In retrospect, I think he made a good decision. We all agree from the professional society. But the general expense started off by the company, which hired more than 500 employees at that time in the 70s. But when we passed national income per capita $5,000, finally, we could cover the whole population. So literally, the universal health coverage started in 1989. And if you see the bottom part, there's a number of medical schools. In the 60s, it was only 10, 5 public and 5 private. But the government, even they installed national health insurance system, didn't have much money to build hospitals and medical schools. So their policy was let the private sector to take over. And whoever wants to build a 500-bed hospital in a local area, then they're allowed to have medical school. So in the 77 already, there are 15 private medical schools opened and total 23. In 1994, there's the end of the new medical schools. So total, we have 41. But 31 is private and 10 is public because we have like 10 province structures. Each province has one, including Seoul. But if you look at the 1994 and the year 2015, the budget for national health insurance increased 10 times in that period. That's one of the reasons is after 1994, we begin to produce more than 3,000 specialists a year. That specialty-oriented care increased the healthcare cost a lot. It's kind of skyrocketing speed. The problem now is, by WHO report this year, Korea is the fastest aging society in the world. So our government predict within 5 years, maybe our national health insurance otherwise will be bankrupt. So it's very dangerous. The sustainability of the healthcare system is in danger. How the national health system consists, the government set the global annual budget, but it is a fee-for-service system. Interestingly enough, by law, all the healthcare providers must be non-profit. But in this case, this fee-for-service system, profit-driven practice in non-profit organization, there was unnecessary competition and unnecessary advertisement. And it is not completely free healthcare. It's a co-payment system, so 30% of inpatient care has to be paid by patient or the patient family. For poor people, it is covered, but for poor people, there are certain procedures not covered by insurance. And also, there are a lot of insurance fraud. And hospitals try to generate more income by doing excessive lab tests, very expensive one, and excessive medication, so which lack the transparency. Maybe we do very mechanical practice, so we have a very weak patient-doctor relationship. As you can see in this picture, the public, compared to public and private, you can see the private sector is dominant. Some allied health professional education, it is totally depend on the private sector. The good thing was the condition the government asked for someone who want to establish a medical school was having 500-bed hospital. That policy was very successful. So we have in every province, there are large, giant, mega hospitals everywhere that provide a better service for sure, in fact. But interestingly enough, we have a nursing shortage, even though we have more than 200 four-year nursing college. Because they're highly qualified nurses doesn't want to go to private clinic or small hospital. They all want to stay in big, large university hospital. So we have a nursing shortage with 200 nursing colleges. That's kind of paradox. The other health professionals, we already overly produced them. And the only thing government can do is, again, set the global budget annually, and then they control the service fee. But the fee structure is in that the outpatient or inpatient care by human service is below the cost, but excessive expensive diagnostic tests give some incentives. That creative, unnecessary test at medication again, and these public facility, by legal, it is a non-profit organization, act as a private entity. And there is government didn't invest any money to the postgraduate training, so we need some fund, so there is a legal and illegal rebate. Government tried to abolish it, but never been successful so far. So the lesson we learned from Korean situation is, even though we have a national health insurance system, still 30% paid from their own pocket, so it's a kind of family burden. Some has disease poor, when a member of family gets sick, they get poor. And there is overuse and misuse of technology in non-covered. Non-covered means insurance will not cover, so there isn't any regulation for this. Usually they're very expensive procedures. So what we need actually is a good medical regulatory practice is required. And from the privatization, we noticed that the medicine become commercialized. It's very difficult to prevent it. And there is unbalanced production of a specialist, which specialty get more income. They are very popular. But the basic like medicine, surgery, popularity is going down now. And I must confess that in East Asian region, we do not have any clear regulatory competent agencies. That culture hasn't been put in place yet. So what we need is a real good medical regulatory authorities. And at the last, I found from this previous speaker, Professor Chang, and I envy that the Chinese government made the decision year 2012 to go for standardizing the postgraduate training by having 5+3 format. This is a really good policy which we don't have in Korea right now. Thank you.